Good morning. Welcome to Children's Mercy's COVID-19 Community Town Hall. My name is Janae Oliver. I have the blessed role of serving as the Children's Mercy Senior Vice President for Philanthropy. And today I will be your commentator. As the nation works towards a road to recovery for COVID-19, what we like to call at Children's Mercy, getting back to getting better, we know you have questions. Is it okay to come to the doctor and to the hospital? Should I really schedule my child's play date? And when will there be a vaccine? So today we have called together 3 of our Children's Mercy experts to talk about those very topics. We are going to hear from them, and then we are going to open it up to you for questions. We hope that you will go ahead and start submitting those questions through the chat feature. We are going to attempt to get through as many of those questions as possible. If we are unable to answer all of the questions during today's session, we will be sending out a recording to everyone who shared their email with us upon signing in today. We also will list all of the questions submitted with answers for your information. So let me introduce to you our 3 Children's Mercy experts. Our first expert is going to be Dr. Stacy Doyle. Dr. Doyle is the Senior Vice President of Ambulatory and Physician Practice Operations. She is going to talk to us today about visiting the doctor and the hospital safely. Our second expert will be Dr. Angie Myers. Dr. Myers will visit with us about navigating play dates, youth sports, pools, and other summer activities. Our third Children's Mercy expert will be Dr. Ellen Grunberg. Dr. Grunberg is research faculty for the Children's Mercy Research Institute Center for Pediatric Genomic Medicine. Dr. Grunberg will talk to us about research initiatives at Children's Mercy and across the nation that talk about the emerging of COVID-19 to understand and treat the virus. So to start our community town hall today, let me invite Dr. Doyle to the podium.
Hi, everybody. I'm Dr. Stacy Doyle, and we're going to talk about getting back to getting better. We're going to talk about what we're doing at Children's Mercy to keep you safe, things you need to think about when you're going to hospitals and to your doctor's offices to receive the care that maybe you've deferred during the COVID crisis. So one thing about pediatric care that is different than adult care is it's rarely actually elective. There's time-sensitive care, and then there's care that we can delay. So during a health crisis, we look at delaying care. We don't want as many people in the hospital. We want to be able to maintain social distance. We don't want to expose people to things. But it's getting time that some of that delayed care is actually becoming care that we need to have. Our patients are getting sicker. Our patients need surgeries. We've been able to put off a few of them, but it's time to get people back in. One of the things that we worry about at Children's Mercy, especially in our emergency department and our urgent cares, as well as our clinics, is that people are delaying care that's really needed. So kids are getting sicker because they're scared to come into the hospital and they're scared to contract COVID. So we want to reassure you that we are ready for you here. We are ready to maintain social distance. We're ready to bring people in a way that creates space between you and the provider, space between you and other patients. And so we are ready and excited to see your patients again. We also don't want you to defer care for kids that are sick. We need you to come into the emergency room and to the urgent care centers because we have ways that we're separating patients there as well. We have special cleaning procedures in place and ways that we get you in even faster, ways that you can wait in alternate areas. And so we will be ready for you when you come back. So here's what we're doing at Children's Mercy. All of us will be wearing masks. All of the visitors, the patients over the age of 2, we're asking to wear masks when they come into our institution. All of the staff that you see will will have masks on as they walk around. Masks are very important, but social distance remains very important also. So even though you have a mask on and somebody else has a mask on, we will be creating that social distance. We will not have you waiting by other people. There will be marks on the floor to show you where you can wait to be safely away from other patients and from healthcare providers. We're thoroughly disinfecting all surfaces. And so when you leave a room, we are wiping everything down. In the ED and urgent care, if there are patients in rooms that we're worried about their symptoms, we're not only disinfecting it, we're leaving the room empty for a while in order to allow the air to circulate in those rooms. So we're creating not only social distance, but distance between patients in other ways. We have strict visitor policies right now. So only one adult should be coming with each patient. That is for our inpatients as well as our patients in clinic, in the emergency room and urgent care centers. During our normal times, it's not unusual to have a mom come in with 3 kids, or a mom and dad and a couple kids come to an appointment. As you can imagine, that adds a lot of people to our institution. And we're trying to keep our institution as empty as possible with just patients and maybe one parent or one guardian to come and hear information. We've increased our amount of telehealth that we're doing. So we're seeing about 60% of our clinic visits right now in telehealth, and we're actively rolling out telehealth for our urgent care centers as well. And then finally, we're screening every single person that comes through our door. So we're asking the questions around symptoms, and if you've had any symptoms that could be related to COVID, if you've had a fever, and we are taking your temperature when you walk in. So if kids are sick, they are getting surgical masks. If parents are having any sort of symptoms, they're getting surgical or hospital grade masks. Every person, though, is asked to wear a mask, whether it be a cloth mask or a hospital grade mask. So please, if you come and see us, make sure you have your mask with you. That'll save us some of our supplies, so we have them available for our patient care staff. So next, Dr. Angie Myers is going to talk about play dates.
Before I start talking about parenting tips, I just wanted to take a quick moment to explain some of the procedures and precautions we've taken place today to start this town hall. So there's only a few people in the room here this morning. We all wore our masks into this room. We are all socially distanced more than 6 feet apart and are using the hand sanitizer to clean our hands before we remove our masks, and we will do that again before we put them on to leave. But we felt that in order for you to hear us the best and to not have confusion, it would be easier for you to understand what we were saying without a mask on. So I want to quickly talk about summer parenting tips. And so we know that COVID-19 is still in Kansas and Missouri. We're still having cases seen, although it does appear to be declining. We are still seeing cases every day be reported. And as we move through different opening procedures through Kansas City, Missouri, and the state of Kansas, and different counties have different rules, which are important for us to continue to look at and monitor as we move forward, you want to think about, what do you feel is safe for your child and your family? So if you decide that it's time to get out and get some play dates, I completely understand. I think many parents are and children are struggling having been at home for this long period of time. Just remember that you need to keep it in small numbers. Remember that if your child is sick or another child is sick, that they should not be playing together. We should still try to do social distancing throughout any type of activity that we decide to engage in. If you have a child that's returning to daycare, we understand that that's incredibly important, and there is guidance that has come out from the CDC to help kind of navigate that, both for parents and for the daycare provider. So some things you want to think about are, what kind of symptom screening is the daycare doing for their employees on a daily basis? What kind of symptom screening are they doing for the children who are coming in? Some daycares are altering their arrival times and having more of a staggered process, so there's not a bolus of a large number of kids coming in at the same time. It's important that kids in one room in a daycare don't mix with kids in another room in a daycare through most of the phases of reopening, and that the teachers stay the same day after day as well. It's also important for the daycare to have a plan of what to do if an employee becomes ill while they're at work or a child becomes ill while they're at work. Obviously, they need to continue to be monitored and tended to, but they need to be separated out from the other children. There's other things that are important to think about too: cleaning high-touch surfaces, bathroom breaks, and really cleaning the toys. So if there's toys that can't be cleaned, then those really shouldn't be used in the daycare setting. So those are some things I want you to kind of think about in your mind as you prepare to maybe send your child back to daycare or things like that. Summer camps are another important thing to think about. Some summer camps are choosing to open a little bit later this summer than others based on recommendations and based on what they feel is safe. Again, many of the same kind of recommendations apply with really screening the summer camp counselors and the staff, as well as the children as they're coming in. And then having frequent hand washing breaks, making sure kids have their own water bottle, that they're not doing family style or buffet style meals, that meals are individual and plated for them, just things of that nature. And then again, thinking about cleaning high-touch surfaces and really trying to continue social distancing throughout that. There's also a lot of questions about youth sports. We have, through our sports medicine group and infectious diseases, created some guidance for youth sports moving forward, and that should be published on our website, if not already, sometime today. And that really goes through thinking about how to hold practices, when to hold practices, what that should look like. Initially, parents really shouldn't be hanging out at practices. They should really try to continue to minimize the number of people that are there. Screening the kids, screening coaches and staff as well to make sure people are well who are coming to practices and games. And then it even talks a little bit about how to do tournaments. I want to stress that it's important that equipment be wiped off in between individual use, and shared equipment obviously needs to be wiped off after games and after play, such as basketballs and other balls. Obviously, basketballs can't be wiped down after each individual use, but they can be wiped down before or after a game. And then kids need to have their own personal equipment that they're not sharing to the best of their ability, that is not considered shared equipment. And then also kids need to be having their own water bottles that are clearly marked and not sharing things like that. And then kids need to be separated out and socially distanced when possible during practices and when they're not in play, sitting on the bench and things of that nature. It's important that you continue to protect your family during this time. So avoiding close contact with people who are sick, avoiding touching your eyes, nose, and mouth, which continues to be a struggle, but is something we need to continue to focus on. Staying home when you're sick. We've touted that for years, around a respiratory season and with influenza, but it's never been more important than it is right now. Covering your cough or sneeze, and in fact, this picture shows somebody having their hand up to their face, and in reality, we would prefer people to cough or sneeze into their elbow so that their hands really are staying clean during that. Cleaning and disinfecting frequently touched objects, and then also washing your hands for at least 20 seconds. And, this is an important thing to continue to do with your children on a daily basis. That's how kids create healthy habits, and singing a different song, letting them pick the song, may be helpful to help instill that and ingrain that in their minds, that they need to be washing their hands before meals, after they use the restroom, and after they touch shared equipment and things of that nature. Now I will introduce Dr. Grunberg.
Thank you, Dr. Myers. My name is Ellen Grunberg. I'm a research faculty here at Children's Mercy, and I will be talking about research in general, and then a little bit about what Children's Mercy and our new research institutes are doing in terms of COVID-19. So I think many with me agrees that research is important. It's an essential activity. It helps us answer questions. It It helps us find better treatments for our patients. It helps us find new treatments, cures for disease. But I think the most important thing with research is really it helps us to find answer to things that are unknown. And during this pandemic, I think this is more evident than ever before. There are so many unknowns. There are so many questions that we need answers to. So for instance, why do we still see so different symptoms in children and adults with COVID-19? Many are asymptomatics, whereas others develop very severe form of the disease. And for us, focusing on the pediatric populations, we wonder why this virus is so different from other viruses that we see. The flu, for instance, which is very dangerous for the young and the old. We know that this novel coronavirus seems to be, in general, being very mild in children. And why is that? However, there are disturbing news that are rare forms of COVID-19 in kids. And what are the underlying factors for those? We've studied seasonal coronaviruses. And what's the difference between this novel SARS-CoV-2 compared to the seasonal coronaviruses that we see every year? And also, how do we treat COVID-19? And how do we treat adults versus kids? Kids are not small adults that we can scale accordingly in terms of doses. They need their own research to benefit themselves and their vulnerable populations. And also, how do we ultimately prevent and cure COVID-19? And we've seen across this country, across the world, that research is more important than ever before right now. And many institutions are dedicating most of their efforts, as well as funding agencies, towards tackling these challenges and answering these questions in regards to COVID-19. And we do the same here at Children's Mercy. And we're very excited and very fortunate to be in a very good place as we see the building of our new Children's Mercy Research Institute and the opening of a state-of-the-art research facility, just opening its doors just a few months away. It's located here on Hospital Hill, close proximity with our adult hall. As we're emphasizing the importance of research today is this close collaboration, close integration between research and the clinics. There are many efforts in the KC metro area and our institution, our partner academic institutions that have initiated research for COVID-19 and understanding these novel coronaviruses. I'll talk a little bit about what some of our immediate efforts are here at the Children's Mercy Research Institute, and that's been focusing on our expertise in genomic medicine, one of the 4 pillars or area of emphasis of our new Children's Mercy Research Institute, and forming a multidisciplinary team with experts in immunology and virology, where we have experts in these fields here at Children's Mercy. We had initiated these multidisciplinary program before the pandemic, before the new coronavirus were starting to circulate. That's really allowed us to quickly change gear and use our tools and use our techniques and staff to now dedicate most of our research towards COVID-19. There's a big team of researchers, clinicians, and partners that are initiating this program. I'm mentioning only some of the team leaders here is myself and Dr. Tommy Pastinen and Dr. Todd Bradley at our Center for Pediatric Genomic Medicine, as well as Dr. Raj Selvarangan, our director of the microbiology team here at Children's Mercy. And we are the teams that have formed this program initiating research towards understanding the novel coronavirus and COVID-19. And broadly, what we want to do is really starting to answer those questions. And again, it's why are the symptoms so varied, and how do we apply that learning to new treatments and cures? And the initial efforts that we are focusing on is trying to follow this infection from day 1 and up to 21 days after an infection, focusing on children and those that are positive for coronavirus, and specifically studying the duration of the virus Where can we detect the virus? Can we detect it across multiple samples in the nasal mucosa, in the saliva? Can we use the stool and blood samples in order to detect this virus? And for how long can we detect it? And how does this virus transmit within a family? If we have a child that are positive for the coronavirus, is it transmitting within the family? And these two areas led by our virology team and led by Dr. Selvarangan and goes under the acronym of the CODIFY study that we all will hear more about in the next few weeks and months to come. Our immunology expert is focusing on the antibody response. When can we detect an antibody of our patients that are positive for the coronavirus, and that's why we have this longitudinal aspect of the study to follow the duration and the detection of these things. The Genome Center is working closely with immunologists and virologists and applying our tools to study both the virus itself, but also the host, meaning the individuals that is infected. And the virus itself is interesting. How does the sequence look like? How's the structure of the virus? Has it changed? We have seen release of the structure, the sequence of this virus when it was detected in late last year. Is it the same of the virus that's circulating here, or has it changed? Has it mutated? But also importantly, studying the individuals here, the patients that are infected with the coronavirus. What cells in our body are affected? And are those cells different than those affected in adults? We know there's a clear age association to this disease. And can we detect specific structures, proteins, genes that are simply not present in kids versus adults? And that would explain why we have a much more milder form in kids. And also applying and working together with one of our largest program here at Children's Mercy, the Genomic Answers for Kids program, aiming to find answers for individuals, for families and kids with rare disease. Do we have a genetic underlying factors for those kids that suffers from COVID-19 and the severe form of that? So these are our initial experiments, our programs. Once we move into recovery phase, potentially a new wave in the fall with co-infections, these programs will expand. There's new programs being added. So stay connected, stay tuned, and more to come. Thank you.
Thanks to our Children's Mercy experts. And we will now move into the question and answer session of our town hall today. And we have lots of questions coming in, so get ready, ladies. Okay, the first one is for you, Dr. Doyle. The question is, what should be determining factors when considering to use telehealth or actually coming to the doctor or hospital?
That's a great question. So we will help you through that. When you call for an appointment, Fred, can you hear it? So we will help you through that when you call for an appointment. We are only seeing patients telehealth that would qualify for telehealth based on our protocols and the way that we treat patients. We may see a patient that in telehealth that we can't get in as quickly just to help come up with a plan in the interim until we can get you here. But if you call in for a telehealth appointment and it's really something that we need to see you in person, we'll let you know that. We'll make an appointment and we'll bring you in safely, just like we talked about before.
Great, thank you so much. Dr. Myers, the next question is for you. I've heard that since we've all been sheltering in place, we have not been building up our immunity, and therefore, we likely will see a spike in other illnesses. Is this true? And if so, how should we handle exposing our kids not only to COVID, but other illnesses too?
Yeah, so that's a great question. So in general, there are a few respiratory viruses that circulate throughout the year that never stop. But most respiratory viruses peak in the winter months when we are all inside what we call respiratory season. So I'm not concerned that we're gonna see an upsurge of influenza as people are more out and about, or an upsurge in RSV, which primarily affects young children. I do think we may see increase in COVID-19 cases. And remember that there are other illnesses that happen in the summer, like tick-borne disease, which we often talk about on the news and in newsletters and things like that, that can have some similarities as well. So there are always going to be illnesses circulating. Most respiratory viruses peak in the winter months, and there's low level circulating in the off-season months. But we may see an increase in COVID-19, and we will more than likely see increases in things that we normally see in the summer, like hand, foot, and mouth disease and tick-borne disease.
Dr. Grunberg, this question asks, if Children's Mercy is really focused on studying COVID in kids, will what you find be applied to adults also?
Again, I think that's a great question, and the answer is yes. I think what we are all excited to see, maybe for the first time, is that we have a very strong age association, meaning that children either lack something or have something not expressed as high. And identifying those things would really help us also to understand why certain adults with the disease reacts very differently.
Thank you. Dr. Myers, this person asks, what is your current, referring to Children's Mercy, policy on testing? And why aren't we testing more children just throughout the city and the country?
Yeah, that's a really great question. So we have recently expanded our testing to include some new guidelines that came out of the CDC last week, as well as the Infectious Diseases Society of America, to kind of expand the symptom profile of people being tested on the inpatient side of the hospital, and including those who are immune compromised or will be getting medicine like chemotherapy. That will cause them to be immune compromised. On the outpatient side, our testing has not ramped up quite as much because there's quite frankly a shortage of testing supplies. Many children's hospitals are having the same issue. It makes complete sense that a lot of the testing supplies that have gone out across the country have largely gone to adult facilities that take care of adults, because adults are seeing so much more disease than children are. We continue to try to increase our stock up to all the testing supplies so that we can continue to add to that and continue to be able to test children who need to be tested.
So this is a great question, and I think it's back to you, Dr. Myers. So do you recommend that kids wear masks while playing baseball games?
That's a great question. So the recommendation that is included in our guidance for getting back to sports, it really does not talk about kids wearing a mask while they're playing a sport. As you can imagine, kids are physically exerting themselves while they're playing a sport, and it's not a great idea. While they're on the bench or not participating, then wearing a mask should be considered. Coaches should be wearing masks during this time, and if there are spectators present, they should also be wearing masks during this time.
Okay, I have another sports question. This person is asking, despite what state and local governments are allowing in these phased openings, the CDC still clearly recommends social distancing and not participating in organized sports. Should we do what is allowed, or let our kids play close contact sports like flag football?
That is a great question. And there's unfortunately no great answer to that great question. You're gonna have to make a decision alongside, your family, what you think is best for your child, and then really understand what your child's team or club, if you will, is doing to ensure the safety of both the staff, so the coaches, and the players, and then also families, if they're allowing families or parents to be present at all. And then after you gather all that data, like I talked about, how are they screening coaches? How are children being screened when they come to play? What is the rules on parents being present? After you kind of understand what they're doing, how they're cleaning things, how they're making sure kids stay separated while they're not in play, so, social distancing, then you're gonna have to just make a personal decision about what to do. I wish I could tell you do this or do that. I just think that this is gonna come down to each individual family making their own decisions.
Great advice. This person asks, how do I get my kids tested for the live virus and or the antibodies?
So that's a great question. So we're testing kids here who meet criteria for testing, like I mentioned previously. We are really have limited use of antibody testing at this point. More information is going to come out about antibody testing. There are some antibody tests that are better than others, and the FDA has been very involved in kind of vetting antibody testing companies at this point. There's many unknowns about antibody testing. While we can detect antibody, so that means it's present in your bloodstream, we right now don't have a great ability to detect how much of it is there and whether or not that antibody is protective from future infection. So there's still a lot of unknown. Antibody can be used to say, yes, you in fact had infection, for the most part, provided that that particular company doesn't have cross-reactivity with the seasonal coronaviruses that also circulate. But it can't tell you at this point, how well are you protected from getting reinfected? We just don't know that information yet.
This next question asks, what do we know about the inflammatory disease that is now in the news and appears to be linked, especially with kids and COVID-19? What do we know about that, and how do we protect our kids?
That's a great question. So it appears that the kids that are getting this are usually a little bit older, so in the teenage age range, and are getting more severe disease. They have high spiking fever for multiple days. There is organ involvement. Sometimes it's heart, renal, GI involvement has also been seen. And they oftentimes they always need hospital care, and oftentimes are needing extra special hospital care, like in an ICU. There are things you should look for in your child, like multiple days of high spiking fever, inability to keep liquids down, so concerns for dehydration, rapid breathing or difficulty breathing, or your child being sleepier than normal. Those would be the things you would look for at home, and you would bring them immediately here to our emergency room, and we would then assess your child and care for them as needed. I want you to keep in mind that even though we're seeing these cases reported, and it is scary and it is happening, it is a very small proportion of all children being infected with COVID-19. And overall, children are a very small proportion of all people being infected with COVID-19. So while it's scary that when these things get reported and it makes us take pause and worry about our own children, I want to reassure you that it's actually a quite rare entity.
So every home cook is asking this question, especially me. The question is, with the opening of restaurants, there is more increased traffic and people interacting with the food and the takeout. Do you feel that this is cause for alarm, or should takeout and delivery still be considered safe?
I think takeout and delivery should still be considered safe. Most restaurants that have been doing this for some time have it down, right? They've been doing it for the last few months. They're screening their employees when they come to work. Their employees are wearing masks. Your food is handled by minimal people. My family personally does Takeout Tuesday every week to try to help local small businesses in Kansas City. I think that takeout is safe. When people start returning to restaurants, there are things that restaurants need to be putting in place. And there's pretty good guidelines on the Kansas Department of Health and Environment website, as well as the CDC, about keeping tables 10 feet apart, keeping booths at least 6 feet apart, so blocking off, every other so that people aren't together. And there's lots of hand washing guidelines as well. So, and limiting the number of people in the establishment. So I think people are really trying to go about this in a safe way to open up their businesses, to allow patrons to come in while still really taking care, maintaining social distance, and using good hand hygiene practices.
Thank you, Dr. Myers. So Dr. Doyle and Dr. Grunberg, I'm sure there will be questions for you soon, but right now on the top of everyone's mind is just the infectious disease. What can I do? What should I be doing? So here's the next one for you, Dr. Myers. What about pools this summer?
Great question.
And then they also ask, obviously social distancing is important, but how would I follow that in a pool setting?
Yeah, that's a wonderful question. So I was reading about this on the CDC website actually this morning, and what they recommend is obviously cleaning high-touch surfaces. If there's pool equipment, so let's say there's lap lanes and people want to do swimming laps, that they have enough equipment so that people can have their own kickboard and not be sharing with somebody else and then wiping them down in between each person using them. So that's just an example. They also talk about moving the deck chairs around in the pool so that there's plenty of space so that like a family is together, but then there's a good deal of space between the next family that's together. They have specific rules around concession stands and not sharing food and not sharing goggles and other things of that nature. They also have specific guidance around, how many people can be in the bathroom at one time, what should be done about the employees in terms of, including lifeguards in terms of screening for symptoms and things of that nature, and actually screening patrons as they come in as well, right? We shouldn't be allowing people who are sick to be at a public pool either.
So kids are very anxious to have play dates, and parents are wondering, one, how many is the appropriate number? Less than 10, is that okay? And then what are your recommendations for social distancing during a play date?
Yeah, that's great. So definitely difficult at any age, even when you think your teenager is able to socially distance, that's certainly questionable. So, I would start small. 10 is actually a lot of kids to have together at one time with one or two parents monitoring. Certainly that is in the Kansas guidelines, but I would start with a couple of friends, and I would try to socially distance as best you can. So get them outside, kicking a ball around or something of that nature. Riding bikes outside is a good activity to do. You can still really be distant, but you can kind of be together and talk, and actually you're doing some physical activity, which I think all of our kids, including mine, really need right now. And so I would try to think of kind of ways in which you can do small numbers and allow them to be together, but still kind of not really close together as best you can.
So what are your thoughts on the new report that Kansas City is now a location to watch? And it's because of the increasing cases that we're seeing of COVID in the area. It's making people kind of hesitant and wondering if it really is safe to start opening up and going out into public more.
Yeah, that's a great question. During this time, we should still be avoiding non-essential travel. We should still be working from home as much as we can. We should still be social distancing. We should be still wearing a mask out in public and doing all of the things, the hand hygiene and staying home if we're sick. Part of this, we have had an outbreak in southwestern Kansas related to meat processing, which we know about. But part of the increase in number of cases is also the state of Kansas has received, and Missouri, an increased number of tests as well, right? So we've gotten more supplies to do more testing. So we expected to see a bit of an influx in cases because when you can test more people, you're gonna find more disease. So I think we still need to continue to monitor this on a daily and weekly basis. It does appear that overall case numbers are decreasing. But yes, we are still seeing cases. I expect we will continue to see cases throughout the summer, throughout the fall, and into the winter. And I think we're just gonna have to continue to look at this on a week-by-week basis to make decisions on, are we ready to move to the next phase? Do we think that it's okay?
What is Children's Mercy's current thought on opening up schools for this fall? Do you think that is going to be possible?
Okay, well, so I'm a parent of two children. One is in high school, one is in middle school, and I am very, very hopeful that schools will be opening. So pardon my bias in this one. I don't know. The state of California has decided that all of their universities, their state universities, will not be holding in-person classes this fall. They are going to be doing all of their education online. I think it remains to be seen what will happen with our schools, and if they do open, are they going to have some sort of modified scheduling, or are they going to try to, have kids spaced out further from each other and use different spaces that wouldn't normally be classrooms, but now are going to be classrooms, like the gymnasium? I don't know. I think it'll be. I think this will continue to play out over the next couple months, and we'll have to see what happens. But I hear you. I am a parent of 2 children. I want my kids back in school. I want to be able to do all of the things.
We've always loved teachers, but we all love them more right now, right? Yes. Okay, some grandparents are wondering, when will it be reasonably safe for grandparents to interact with their little ones again?
That's a great question. And I know that a lot of grandparents have been away from their grandchildren, and that is so hard. So, I think I think it depends on your family decision and what kind of exposures your grandkids have had to kind of just the regular outdoor community and environment. If they've been home this whole time and really have had minimal exposure, then I think the risk is much lower for you to see them and interact with them and be with them. I do think you need to continue to do social distancing and do lots of hand hygiene and still be cautious. But it's different than if your grandchild is out and about in the world and, involved in sports tournaments and is really, having more exposures, and you have to look at your own, individual health. Do you have underlying health conditions that put you at higher risk? Do you have diabetes? Do you have heart disease? Do you have things that, if you were to get COVID, might put you at a higher risk to get very severely sick? So I think you have to kind of look at your individual health status and then kind of what your exposure might be based on kind of what your family's activities are.
Mm-hmm. We're going to give you a break, Dr. Myers. Dr. Grunberg, question is, do we know why or have any insights as to why some people have very severe symptoms and others do not?
Well, what Dr. Myers was saying with underlying health condition, I think that's something it's clear. If we're looking at a general population where young people without any of those underlying conditions, we don't know. And there's large initiative on the genetic consortia out there now, collaborating across continents to start to ask, is there genetic predisposition where you don't have any of these and you actually develops a severe form? And that's the same thing that we want to ask in our pediatric population too. There's luckily a mild form of COVID in kids and few seems to be infected, but there still are. And those that are infected, do they have a genetic predisposition that we can test and in the future then prevent that to happen?
So lots of questions to still be answered, but we're working on it. Dr. Myers, back to you. If a child has a suppressed immune system, do you believe they should continue to be quarantined? And what about other people who live in the same home? Should they also be quarantined?
Yeah, that's a great question. I know that this is so incredibly difficult. Right now, it is better for your child with a suppressed immune system to be at home as much as possible and not out in the community. Obviously, that may not be completely feasible, and so when you do need to take them out, to use all of the precautions that we've talked about with masks and hand hygiene and social distancing. It's also, ideal to be at home as much as possible still, even though things are opening up and people want to get outside to protect your child who is immune compromised. It is ideal. Does that mean that you shouldn't go to the store or go to other places? No, it doesn't. You have to make those decisions and do what you need to do for your family and also your mental health. But just be careful and take precautions when you do that.
Stacy, one of our friends is asking, how are the staff at Children's Mercy prepping for patients who are obviously children or teens versus what might be happening for staff who are prepping for adults at an adult hospital?
Yeah, that's a really good question. So we think our patients are the most special patients. I'm sure you agree if you're a friend of Children's Mercy. And we have to prep different than adult facilities. And so imagine trying to keep a mask on a 3-year-old during a visit. That's the type of things that our nurses our child life specialists, our care assistants are working on. So we will be ready for your kids, making it fun for them to wear masks, making it fun for them to social distance. We're doing the same things that you're going to see at the adult facilities that you go to, as far as marks on the floor and social distancing and extra hand hygiene and wearing all of the masks. But we're going to do all of that in our very special Children's Mercy way. And if you've been to our places, you've seen the amazing art on the wall, the iPads that we have available, the lights on the ceiling. We're getting rid of some things like books and magazines that people would be in high-touch areas and tempted to touch and hand on to somebody else. And so we're getting rid of some of those things and moving to more toward toys and activities that we can fully disinfect or that are disposable. So you'll definitely see a change when you come in here, but we want it to be the same Children's Mercy experience. Kids love coming to see us, and we love seeing them. And so we want to provide care in that way. It'll just be different and safe, but it'll still feel like Children's Mercy. It'll still feel like a children's hospital, and some fun sterility, I would say, in our areas.
Our masks are going to be fun.
We're working on it.
Yeah. Dr. Myers, this person is asking a follow-up question to your response regarding grandparents. So if their child has been to daycare, is it safe for them to see their grandparents, or should they not, since they've been to daycare?
Yeah, that's a great question. So I would get the information about the daycare that you can, in discussion with your family. How are they ensuring that their staff are safe? How are they ensuring that the children are safe when they come in every day? Are they symptom screening? Are they temperature checking? What kinds of things are they doing to make sure that they've kept the daycare, clean? Have they removed toys that really can't be, easily cleaned? Are they making sure that when the kids nap at the daycare, they're keeping them, 6 feet apart by head to foot, or some other method? I think that might provide you some reassurance that they're doing all of the things that they can be doing to keep your grandchild safe, which would then hopefully allay your fears a little bit about seeing your grandchild. But again, you still have to look at your own personal health risks as well.
Here's an important question. What about sleepovers? Should they be allowed? And this is in regards to COVID.
Right, yeah. So I would hold off on sleepovers for now with your kids. I know that this is hard, and I know kids are really wanting to get back to it. I would really focus on during the day activities where kids can be well monitored and supervised, and you can maintain social distancing. But, kids do all kinds of crazy things at sleepovers. At least mine do, and I would put a word of caution out for that right now.
Good advice, although every child listening in is totally disappointed right now. This question, perhaps Dr. Grunberg, they are asking about risks regarding pregnant women, and especially to unborn babies. Are there precautions that pregnant women should be taking?
I have to give that question to Dr. Myers.
Yeah, so it really hasn't borne out to this point, based on the data that's available, that pregnant women are increased risk for more severe disease than the non-pregnant women. So they in fact are at risk for COVID, the same risk that any of us are at to get infected, but not for severe disease per se. We also don't have data that has borne out to this point that there is fetal transmission of infection. So unlike some other diseases that were in the news in the last few years, like Zika virus. So while there's risk to being infected in general by being in the public, it doesn't appear that pregnant women are any greater risk right now. And doing all of the normal things that we should be doing, like wearing masks and hand hygiene and staying home when you're ill and staying away from sick people, obviously, are really still just paramount to do.
Thank you. Dr. Doyle, the question being asked is, how early should someone arrive at their appointment at Children's Mercy to get through the screening process?
Great question. So we have lots of screening stations set up. So the screening process will not take a lot of time when you get here. It'll just take a few seconds for you to get through that. I would say we don't want you to arrive too early right now because we are trying to keep our waiting rooms as empty as possible and keep the hospital very socially distanced. We are working on some plans for when we really start to ramp up our visits where you'll be able to wait in your car, text us and let us know that you're here, and then we can text you and let you know when it's safe for you to come in and come up to the clinic. So the screening procedures really won't take that long. They're well staffed. It goes very quickly. We don't touch you when we take your temperature, so we use a tiny little laser and put it up to your forehead. But we do want you here early enough that we can get you in and get you comfortable before you see the doctor. So when you make your appointment, you'll get more information about that. You'll also hear more about the texting option to let us know that you're here.
Great, thank you.
Oh, and one more thing, urgent care. So for urgent care, we actually have an app already where you can get online and pick a time to arrive. So make sure that you get on our website and hit the urgent care up that way. It helps us level out the day and gives you a time to come in safely.
And from someone who has had to use that, that is a wonderful feature. Saves lots of time.
I use it too.
Dr. Myers, could you talk a little bit about for children who have asthma or other pre-existing conditions, how are they faring not only in Children's Mercy, Kansas City, but across the nation with COVID?
Yeah, that's a great question. So many viruses trigger asthma exacerbations, as do allergies. And this is actually a time of year where we typically see an increase in asthma exacerbations in children. It does appear that for the severe form of COVID disease, there may be some risk factors based on what's been reported. But again, these are very small numbers, so we can't really draw conclusions at this point. But it does appear that obesity and other underlying chronic diseases are risk factors for having more severe infection, somewhat similar to adults.
Mm-hmm. Okay, Dr. Doyle, this is a really good question. How would one go about handling children if they are scared or struggling with wearing a mask, but yet we really want them to in public?
That is a really tough one. My kids hate their masks. They think they are stinky. They think they're uncomfortable, and they're right. But we wear them anyway. And so we will have some resources on our website around masking children and some additional guidance in that going forward. I think for the younger kids, making sure that the mask is comfortable, it fits comfortably, and they can remove it. I would say kids either with developmental delays or cognitive delays that cannot remove their own mask really should not be masked. So keep that in mind. Children under the age of 2 or kids that are in strollers, try to cover them in a different way, maybe a loose blanket that goes over the stroller. Otherwise, do everything you can to make the kids' masks fun, to make it fun for the kids. Older kids, you know, my kids are a little bit older than toddler age, and we talk about how important it is to stay safe. And it's not just keeping yourself safe, it's keeping other people safe as well. And so a lot of kids, when they hit reasoning, can do that. Otherwise, we've seen a lot of people with success with fun masks, exciting masks, different characters. I know several people are making those for kids, and so it makes it a little bit more fun to wear the masks. Also, remember social distancing is really important, and you know, keeping your kids outside and away from other people where maybe they don't have to wear the mask as often is helpful too.
So this person asked, there's been a lot of advice given even today about pre-screening. But if so many people don't have symptoms, but then are actually have COVID, what use is pre-screening?
Yeah, that's a great question. So I want to clear up a little bit of, I think, what's gone on in the news and confusion about that. There's asymptomatic transmission where you may transmit infection to another person without any symptoms, which is why we're wearing masks in public so that our droplets from our mouths do not, reach something in the environment, either an object that somebody then touches or just actually reach another person. That's also why we're socially distancing, because large droplets that come out of your mouth from a cough or a sneeze, they fall to the ground, within 6 feet. And so that's where the 6 feet comes from. There's also pre-symptomatic transmission. Pre-symptomatic is actually you are infective, so you have infectious virus that is building in your nose, in your mouth, about 2, maybe 3 days before the symptoms start. And then there's obviously symptomatic transmission as well. The majority of people have symptoms. It's just that they have mild symptoms. So there's actually a small percentage of people who are completely asymptomatic and infected and never develop symptoms. The majority of people are pre-symptomatic and go on to develop symptoms, typically in the next 1 to 2 days. It has been reported out to 3 as well. So I just want to put that out there. So while that does make sense that you may be screened negative, but then be shedding virus, presumably the majority of you will develop symptoms in the next day or 2. That's what makes contact tracing at that point so important. So let me speak for a second on that. So that is when somebody who came into contact with somebody else or another group of people exposed other people. Let's take the daycare for an example. What then happens is somebody from the health department or personnel from the daycare themselves, they then look at all of the people that infected person came into contact with and then kind of draw a circle around that, contacting all of those people to let them know they were exposed. And then those people need to be doing enhanced surveillance of themselves, right? Monitoring their own selves for symptoms on a daily basis. And that's what contact tracing is all about. In addition, oftentimes the health department asks people to stay at home if they've been exposed to somebody with known COVID, and that different health departments have different rules on that. And so, you have to kind of look at where you live. But those two pieces together are what's really important, and what kind of Dr. Fauci and other folks at the national level have been kind of talking about over and over, is that you have to have both parts. You have to have the screening up front, you have to have the ability to test, so I guess 3 parts, and you have to then be able to do the contact tracing afterwards.
Excellent, thank you. This question is wondering if in the public pools, you spoke about social distancing, et cetera, but the specific question is, can COVID be spread in the water?
Yeah, that's a great question. So I haven't seen any data about COVID being spread in the water. I think it's highly unlikely. I think if it gets spread at public pools, it's going to be spread from shared equipment or touching handrails or touching other things that other people are touching.
How readily available is the COVID testing at Children's Mercy for kids, and if not at Children's Mercy, across the community?
Yeah, that's a great question. So in some places across the community, they will test children down to 2 years of age, but not below. That's largely because a lot of adult facilities and the health department have a limited or no swabs for children under 2. So children under 2, we use a much smaller swab to get the sample because, as you imagine, their nose is much smaller. And so that's one kind of limitation. We have supplies here to test kids who are symptomatic and being admitted to the hospital, kids who are immune compromised and need to be tested, and kids who are symptomatic on the outside, so in the outpatient setting, who also are in a high-risk situation, either immune compromised or going to or living in a communal facility. In addition, we are also testing children pre-procedurally so that we can make sure that we do the procedure safe, we keep our employees safe, we keep the patient and family safe as well.
Excellent. Dr. Grunberg, we have time for one last question. And the question is, are there trials or research studies available for children who have developed COVID symptoms or have been diagnosed with COVID?
I can pass on that question too, but I can say that not that I am aware of, but I think there's a lot of efforts going on in the pediatric population now, but I don't know if Dr. Myers knows more specific.
Yeah, so there's several registries going on. There's a registry for the kids who have this severe inflammatory syndrome that we are participating, that Children's Mercy is participating in. This is through the Pediatric Intensive Care Society as well as Cardiology Society. There are also other studies that are ongoing or registries are ongoing for kids who end up getting treatment like with remdesivir and things of that nature. And then of course, right now there's no vaccine trial in children. We are hoping to be a site when that opens up for for children.
Dr. Doyle, Dr. Myers, and Dr. Grunberg, thank you so much for sharing your expertise with our friends of Children's Mercy. And most importantly, thanks to all of you for joining us today. We hope that you have enjoyed our community town hall. We had so many questions. We know we did not get to all of them. We tried to answer as many as we possibly could. Please remember that we will be sending to everyone that we have an email who signed in today a recording of today's session, as well as a question and answer that will provide a listing of all the questions that were asked and also answers for those questions. If you have questions that you had hoped to ask or you think about them later today, you can still submit those. Simply send an email to giving@cmh.edu. and we will respond. So we thank you. We wish you a wonderful, healthy day as we at Children's Mercy focus on getting back to getting better.